Hello, I'm Tony Buffington. I'd like to thank the Interstitial Cystitis Association, the ICA, for inviting me to talk with you a little bit this morning about how new chronic pain research may provide some help for your IC journey. As we know, recovery from IC truly is a heroine's journey, as Susanna Miller shows on her map here on the right. And some good news is that there's been so much learned about chronic pain in recent years that can help us along this journey. I'd like to share just a few of those things with you today. So I'm going to play the waiter, and here's our menu on the left of things to consider. First is safety, then self-compassion, talk a little bit about coaching, having patience, addressing healthcare, your history, your social world, talk a little bit about what life means to you and how to empower yourself as you continue on your journey. This is a menu. It's way too much to take in all at one time, but I'm hoping that at least one of the things on this menu might interest you enough that you'll want to look into it a little bit further. So let's talk about each one just a little bit. First is safety, number one. And sort of forever, people have thought about pain being associated with tissue damage. And that's true, it can be, and we can often see that. But pain, what's been learned recently is that pain is really a warning about danger somewhere. And it can either be the tissue damage or other places in our environment. For example, if people don't believe you, or a doctor says, I can't find anything wrong, that can result in social pain. And then there's the dark night of the soul of existential pain, about wondering, is life even like this even worth living? And here's the thing, some of those dangers are not even conscious. So how can you tell? Well, look around and try to notice how you feel when you're in different places or with different people. If you notice that you're feeling better where you are, that's a good thing. If you notice that you're feeling worse, that may cue you that there's something dangerous about that situation that your brain is trying to warn you about, and you might want to give that a little bit of thought. Number two, self-compassion. This means giving yourself the kindness and care that you would give another person with chronic pain. Because chronic pain is real pain, as you know, and it's not your fault. And you deserve help on your journey, not blame or shame. I was looking for Dr. Ness's name. Dr. Kristen Ness has a really good website on self-compassion and also a new book on the subject that I like a lot. Number three, find a coach. Having some help on your journey will make it a lot easier. And that can be anyone, as long as that person believes in you, and wants to help you. Maybe they can go with you on medical appointments if you need to, or advocate for you as necessary. Or maybe you can just pat you on the back and give you the support you need when you're having a bad day. There's also now professional health and wellness coaches, often that can be paid for by insurance, that have been trained to give you the kind of support and guidance you need on your journey. Number four, have patience with yourself. As one chronic pain patient recently said, recovery is as complex as pain itself, because it takes time. IC didn't develop over a few weeks, and it's not going to get better over a few weeks. It also might, and that can be frustrating, particularly for people who are busy, active people and all of a sudden have been taken down by this chronic pain syndrome. Sometimes it also means tapering off pain medications that really don't do much good for interstitial cystitis and have some bad side effects as well. Sometimes IC can take over your whole life and require you to think about becoming a new person in a new world. And just like a butterfly coming out of a cocoon, that can be a struggle. Number 5, healthcare. If you possibly can, find healthcare givers who believe you, who trust you. They might not know about IC. It's not taught very much in schools, unfortunately, but they can certainly learn. And the ICA website is a really good place to learn if they're willing to. And you need your doctor to be watchful for other things. Unfortunately, people with IC are also at greater risk for other chronic pain syndromes. And you could even develop a urinary tract infection or other bladder problem that could be treated and would have to be addressed separately from your IC. So you want a doctor that's on your side. Number 6, your history. New research has shown that there can be genetic and familial predispositions to interstitial cystitis. And so if you don't know about people in your family, ask to see if there's people in your family that have IC or other chronic pain conditions, which might give you an idea about where it came from. What's also been found recently is that dangerous environments, even before you're born, that affected your mom or when you were very young, could sensitize your threat response system to your environment. That's exactly what we found in cats. It turned out that a number of the cats that we studied that had severe IC had been orphaned as kittens and raised by their owners. And some of these cats were very sensitive to their surroundings, but we found that when we could coach their owners to create a home environment for the cat that was safe and predictable and gave the cat some choice, that they got better just as easily as the other cats did. Within about 6 months, some of them even sooner. So it certainly doesn't prevent recovery. It's just worth knowing about. Number 7, your social world. We are a social species, actually much more social than cats are. And so when conflict develops with friends or family or at work, that can also affect our health and certainly our symptoms of IC. But it even goes beyond that to our surroundings, the culture we live in, the built environment, whether we live in a city that's noisy and dirty and difficult to navigate, or the country. All those things are being monitored by our being, our body and our brain, to let us know whether we feel safe or in danger. And so those are also things to think about that really haven't been paid very much attention to, unfortunately, in research and care for IC. And that's just starting in the last couple of years to be looked at seriously. So I'm hoping that we're going to get a lot of good information on how our social world affects us and what we can do about it. Number 8, what life means to you. This is that existential piece. And from a personal point of view, how can you live your life with meaning in the face of IC? They're the social world. Your social world can also help as much as it can hinder you when you have friends and family and healthcare givers and others who believe you and support you. Some of you may have religious or spiritual practices that you can draw strength from. And there's good research evidence that we can draw strength and peace from nature. So if you have the opportunity and you can get out into nature and that sounds like something that you'd like to do, it might help. Number 9, empowering yourself, taking control. That requires safety. It helps to have trusted and trusting care, as it says here, but feeling that you're heard and validated for who you are as a person. You're not your IC. You're a person in your own right. And that gift of feeling heard and validated will help you make choices that you believe in to continue you on your road to recovery. Number 10, continuing your journey. As we said, it's a heroine's journey. And IC isn't one ill, one pill, one bill medicine, as we know. It's a lot like more of our daily chores of bathing and brushing. And it can take it takes work every day, which is just like life, which really is the work of a lifetime. So just to summarize, here we've got the menu again, hopefully to help you on your heroine's journey. I encourage you to just pick one to start with. Take a look at that, because depending on where you are in your journey, what your environment's like, one or more of these may be more important or more relevant to you at your path on your road to recovery than others are at this moment. So just pick one and see if you like that. I'll just leave you with some resources. This is kind of a messy slide here. Sorry, technical difficulties. Just trying to turn the camera off so you can see the slide, and I'll leave it up here for a few minutes. These are just a few suggestions to get you started. This is the menu, and you can just stick these words into, or the way I've written them with quotes around them can sometimes help a little bit. Stick those into an internet browser to find out more information. And there's a couple of links down here that you might use. One of is to Suzanne Liller's Heroine's Journey. And there's also a new app called Curable that may be of use for some people. So thank you very much, and I hope this helps you on your journey. Have a good day.